Welcome, everybody. It is Thursday, April 4th. Wanted to focus on some series of presentations that would really kind of get into the deep dives of integrative oncology and cancer treatment, but do it in a way that is really focusing on the uniqueness of this integrative strategy, the uniqueness of natural therapies that are out there. But then dive in the science. It's really important. We must lead with the science. The science is the arena. It's the field in which science is debated and public discourse occurs. And so one of the things that I say that's very important, in fact, about a year ago, I said, look, 2024 is going to be a year of really focusing on research. That's been one of my goals for this year, is to really focus on research. And I must say that actually has happened. We just announced the first IV CBD research clinical study, and IRB approved. Just announced that with a PR piece yesterday. I've got a white paper up on that. Check that out. Also, I encourage you to check out, we're doing a multi-center observational study on ivermectin in cancer, Dr. Paul Merrick, Pierre Corey. So really pushing into that arena of not just knowing the science of natural, holistic, and integrated treatment strategies, but also focusing on the science of these strategies, deep in it. And this really comes from, this presentation here is just a portion of it, and it actually comes from a presentation I created pre-pandemic. It was actually probably 2019. I was supposed to give it in Germany at a conference, but never got to, obviously, because of the whole world closing down and effectively going nuts. But now at least we're getting some of our sanity back. But I wanted to pull this out piece by piece. And tonight I want to talk about Artesunate. You may go, excuse me? Well, we'll talk about it, and it's going to blow your mind. There's a lot about it that's going to blow your mind, but what's going to not blow your mind is, of course, that it has incredibly anti-cancer efficacy. It's very effective in treatment of cancer. So I entitled this, What We Know, What We Think We Know, and What We Don't Know About Artesunate. Now, what is Artesunate? Well, it's not much. It is a molecule that comes from Artemisinin annua, which is sweet wormwood. That's where it comes from. Nothing special about it for sure, but it has very powerful treatment options and therapeutic benefits in cancer alone, but also in conjunction. And by the way, might I say, drop in some questions, and as soon as some questions come in here, I'll be happy to answer those for you, not necessarily at the end, but as we go through this process. So this is just a world map looking at where you can find a lot of Artesunate. And a lot of it is actually here in the U.S., but as you can see, it's in Asia, India, Central and Eastern Europe, in the temperate regions in the America, Africa, and Australia area, especially in the tropics. And if you look off the coast, east of Africa, there's that big island there. That's Madagascar. And Madagascar is actually where they do a ton of growing of artesunate, and they actually process, sweet wormwood, they actually process a lot of that into artesunate. Now, you may have heard, what artesunate? I've not heard of that, but I've heard of artemisinin. That's correct. Artemisinin is another form of artesunate. Artesunate is the form that is the IV form. It's of course goes through a series of chemical reactions to take from sweet wormwood to then artesunate, which is given IV. But artemisinin, is a form that can be given both IV and a form that can be given both orally. And I would say that my clinical experience, having used artesunate now since 2018, is that artesunate in the IV form is by far the best route of delivery. So where did this all come from? Well, really interesting when you look at history, because if you know anything about me, I love history. History tells us where we came from because it then tells us where we are going. 2015 is a year that has had a huge impact in the field of integrative cancer. Artemisinin was instrumental in a team winning the Nobel Prize in Physiology and Medicine in 2015. That was the Dr. Yo-Yo 2 for the treatment of malaria with not sweet wormwood, but with artemisinin, which was derived from sweet wormwood. Now, they were using this because they were trying to identify old treatments, traditional Chinese treatments, in search for newer but cheaper, more cost-effective treatments for malaria. So this was coming out of China. This team had been working on the sweet wormwood plant since 1972. So quite a while. But their work bore fruit that then finally awarded them the Nobel Prize of Physiology and Medicine in 2015. And again, this team was out of China. Now, what's really interesting is about that same time, and in fact, that same year, 2015, there was another group that won the Nobel Prize in Medicine. Artesunate was for the treatment of malaria, which is a parasite. Plasmodium falciparum, which is a parasite that you get from mosquitoes. But here with ivermectin, what we're seeing is in 2015 was a treatment for other parasites. So in 2015, two teams investigating antiparasitics, artesunate and ivermectin, for the treatment of different parasites. Now we know that both of these have anti-cancer benefits. It was really interesting. We had a social media direct message or response, on one of our platforms. And I had talked about or mentioned the 10 anti-cancer benefits of ivermectin. And all I did was quoting studies. And of course, we got some pushback from that. And so I went ahead and posted the list to the references of 48 published articles highlighting those 10 anti-cancer mechanisms of ivermectin. At the end of this, there will be a QR code. I encourage you to take a photo of that and use that to take your own deep dive, your own rabbit trail, if you will, looking at artesunate. And if you've heard any of my talks, webinars, podcasts, I talk a lot about multiomics. Multiomics is really the pivot point in history in medicine from the last 100 years, which is the one-size-fits-all approach, to the pivot of actually precision cancer care. And what precision cancer care is, it's the right treatment for the right patient at the right time. It's no guesswork. It's not a protocolology approach to the treatment of cancer, but it's actually recognizing patterns. It's actually being a scientist and blending that with the delivery through art. That is medicine, the equal distribution and combination and really synergy of science of medicine and art of medicine. And so I talk a lot about genomics, epigenomics, transcriptomics, hormonomics, proteomics, metabolomics, immunomodulomics, microbiomics. These are the studies of these individual areas, and that's what omics means. And they contribute to the overall health and wellness of the individual, or the lack thereof, which is disease. Remember, the word disease literally means the lack of wellness. And of course, all of these are really pivotal in how we focus on the individual. So then let's look specifically at what we know, part of what we know, what we think we know, and what we don't know. What do we know about artesunate in cancer? Well, research, and again, link will be present at the end of this presentation. Artesunate has been shown to be effective in pancreatic cancer, osteosarcoma, lung cancer, melanoma, colorectal cancer, breast cancer, ovarian cancer, esophageal cancer, gastric cancer, prostate. Very effective in prostate cancer, especially when combined with high-dose vitamin C. Lymphomas, leukemias, hepatocellular carcinoma, or liver. And I would say anytime there's metastatic disease that has spread to the liver, not just primary disease in the liver. Renal cell carcinoma, bladder cancer, glioblastoma, and schwannomas. So CNS tumors. And of course, glioblastoma is a very, very aggressive tumor type in the brain, of which, when you look at mortality at 5 years, 95% mortality. So very, very high mortality, very, very high morbidity. Interestingly enough, malaria can go to the brain. Interestingly enough, artesunate as a treatment of malaria passes right through that blood-brain barrier. So if you have a glioblastoma or tumors that have spread through the blood-brain barrier into the brain, artesunate is an effective therapy to cross that blood-brain barrier. And I would say this, observationally, I'm seeing more cancer that is spread to the brain than I have seen previously. Okay, here's a good one. Okay, is artesunate antiviral? Hold that thought, hold that question, because we'll come back to it. And most people may go, what do you mean, artesunate antiviral? Well, ivermectin's antiviral. And this research has been known a long time. So the question is artesunate antiviral? We'll get to that answer in a moment. Good question. Very good question. So what also do we know about artesunate in cancer? Well, most of the studies are in vitro, in vivo, and there are a fairly large number of human studies, phase 1, phase 2, and phase 3, of artesunate in the treatment of cancer in humans. Now, one caveat to that is the vast majority of that is via the oral route, the mouth. So most of the therapies looking at the artemisinin, artesunate, and derivatives from sweet wormwood are looking at it through the oral route. And going back to some presentations I've given on vitamin C, curcumin, CBD, the bioavailability, the absorption, the pharmacokinetics of how that goes through the gut to the rest of the body really limits the oral route. But, in the Western part of the world, that tends to be the primary mode of treatment. But it's not the most effectiveness. So we have a lot of studies, despite this not being an old therapy at all. And really, it's amazing that this therapy has taken off so fast, but most of that is because of its benefit to malaria. In fact, it is a gold standard treatment for malaria. I actually had the pleasure of traveling out to the country of Mauritius. We were trying to start some research there, and that was before the pandemic. And of course, that caused everything to collapse. So what do we know about artesunate and cancer broadly? We need to know the what, and then we need to know the how. So it's anti-growth. That's what anti-proliferative means. It's pro-apoptotic. That's programmed cell death. It's anti-angiogenic, and I got a little bit of a typo there. It's immunomodulatory. There we go. Got that right. Immunomodulatory. It affects epigenetics. And remember, epigenetics means above genetics. So it's affecting genetic expression. It readily crosses the blood-brain barrier. It's sensitizing for radiation, meaning you can give it in conjunction with radiation, and it's going to improve the efficacy of radiation, which will hopefully help lower the dose of the radiation and the associated side effects. It's a chemosensitizer. Giving it with chemo can optimize chemo. And again, same process. Hopefully lower the dose of chemo and limit the collateral damage, if any at all. It reverses multi-drug resistance, and this is primarily via its effect on the transcription of ABCG2 drug efflux, and this is a protein that basically pumps the drug right out of the cell, here that being artesunate. And guess what? It's safe in pregnancy, lactation, and children. I was referencing the ability of artesunate to go through the brain, the blood-brain barrier, into the brain for the treatment of malaria. That was actually a treatment in children. So what do we know about artesunate in the treatment of cancer? But here, much more specific in detail. Anti-growth. Well, here the slide before we talked about the what. Now we're kind of going down the rabbit hole. The how. What are the details? What are the specific how mechanisms that this is actually stopping the cancer growth? Well, it decreases P13K, AKT, and mTOR expression. This is a very pro-growth pathway that many cancers will take advantage of. It's very important to understand that cancer does not make anything of its own, in essence. It takes advantage of that around us. If any of you have worked out lifting weights, your muscles have taken advantage of this pathway, P13K, AKT, mTOR pathway. You break the muscle down to build it back bigger, stronger, And that's exactly what this pathway does. And so what cancer does is it comes along, it doesn't come along, it just goes, wow, I can make use of these mutations in my cells. And so it does, and that promotes its own growth. Artesunate decreases the expression of these proteins. It inhibits the WNT beta-catenin pathway. This is a very important cell signaling pathway. It activates multiple other pathways, nuclear factor kappa B, P13K, AKT-mTOR. So it activates the hedgehog. Yeah, I know who came up with that one, hedgehog pathway. But it activates these many different pathways. So it's really kind of a central spoke, if you will. It inhibits COX-2. If you've taken Celebrex, which is celecoxib, this is a specific COX-2 inhibitor. And the expression of COX-2 by cancer is very important in its invasion and how it spreads. So here, artesunate is inhibiting COX-2. So if a patient comes to see me and their cancer through genomics, epigenomics, circulating tumor, circulating fragment DNA, tissue analysis, if that's expressing COX-2, guess what? We can target that via a multitude of ways, integratively, holistically, naturally. We can do so with Celebrex, or we could do so with artesunate. So you don't just have to guess. You can look to the target and go right after it. It inhibits prostaglandin E. It arrests the cell cycle growth at the G2M1 M phase, and it decreases the expression of Ki67. This is a pro-growth marker. If you ever, unfortunately, nobody listening will be diagnosed with breast cancer, but if you were, they will look at the receptors. They should look at so much more than just estrogen receptor, progesterone receptor, and HER2. But they will also typically add in this Ki67, which is a pro-growth proliferative index. The higher it is, the more faster and higher the growth rate of the cancer. Here, artesunate is decreasing that growth index. So that's the anti-growth. Pro-apoptotic. This is a defense mechanism. This is programmed cell death. Many of the treatments that we employ today actually are used to trigger and stimulate apoptosis. And there's many other parts of these programmed cell death options. We'll talk about those in a second. And this is primarily an iron-mediated, in some ways, overwhelming oxidative stress production. Very interesting. Artesunate is a beautiful synergistic treatment with vitamin C. A before C, and that's not going back to English. A before C for the treatment of cancer. Artesunate before vitamin C. Inhibition of STAT3, activation of capsase 3 and capsase 8. Sorry about a typo there, not cascade 8. It increases the BCL Rambo, and this is independent of the BCL Bax ratio, which is typically involved in triggering apoptosis. And it decreases BCL2, decreases BCL-XL, increases Bax, and inhibits survivin. So the point here is not to just look at, okay, artesunate, there's some studies somewhere that focuses on how it triggers programmed cell death via the mechanism called apoptosis. Yes, it does. But here's the big point. It does it via a variety of different mechanisms, of which a multitude of studies have shown, of which what we know exists. So we can see the pathway. We can see what it does and how it does it. And we can just follow that right down to the treatment and the efficacy. So again, it's programmed cell death, and apoptosis is one form of that. But it's currently recognized, and there's probably going to be more as we get more data. There's currently recognized 6 forms of programmed cell death. This is cell death that is it's divided into programmed cell death and non-programmed cell death. And this is an important process by which even healthy cells and healthy tissue can take part of. This is not just a process to employ to treat cancer. There's apoptosis. There's ferroptosis, which is with iron. There's autophagy. There's necroptosis. There's cuproptosis, that's with copper. And there's pyroptosis, inflammatory. So there's many different mechanisms of programmed cell death. But here, artesunate is involved with cancer treatment via apoptosis, ferroptosis, which requires iron and ferritin, as well as autophagy. So 3 mechanisms by which artesunate is triggering programmed cell death of cancer. Let's see if we've got any more questions here. Okay. Cell cycle arrest. Yes, it's involved with proliferation, pro-growth, but cell cycle arrest a little bit more greater in detail. So what's down that rabbit hole of artesunate in cell cycle arrest in cancer? It arrests the cell cycle, remember mitosis, at the G0, G1 phase. It downregulates cyclin D1, CDK4, CDK1, cyclin AB. These are molecules that help to push the cells through those stages of mitosis. Think way back in elementary school, junior high, mitosis, how one cell is going to eventually become two. And thus cancer, one cell becomes two, becomes four, becomes eight. It blocks the G2M progression and it upregulates Beclin 1. So here, it's not just that, this is interesting that artesunate seems to inhibit the mitotic phases of cancer cells, but we understand the exact mechanisms. Again, reference will be at the end. Anti-angiogenic, talk a lot about that. So anti-angiogenesis, well, angiogenesis is a key process that cancer must employ. Cancer is growing very rapidly. I encourage you to check out there's going to be a podcast dropping this week dealing with ketogenic diet as a metabolic therapy in the treatment of cancer. Had the pleasure of talking to Thomas Seyfried and really exploring this concept in the treatment of cancer. But angiogenesis, as this cancer is growing rapidly, the cancer must upregulate the blood vessel supply growth. And as it does that, it does it very inefficiently. It's very tortuous. It's just not an effective delivery mechanism. At the same time, it must eliminate waste. And so as cancer grows, angiogenesis becomes an incremental process involved in how that cancer will grow, be supported, and spread. Artesunate targets angiogenesis. It decreases vascular endothelial growth factor. It downregulates VEGFR, the receptor. It downregulates angiopoietin 1, and it decreases the activation of ERK1. So here again, angiogenesis, very important in cancer, but artesunate is very involved in the how of this angiogenesis process in cancer. And just one little caveat, a tumor marker that most people will equate to colorectal cancer, that CEA, it can be a very good associative tumor marker, meaning it's not specific to the type of cancer, but it's associated broadly with the cancer. So if you have a loved one or yourself or family or friend that is diagnosed with cancer and the CEA is elevated and they don't have colorectal cancer, think angiogenesis. Here, think artesunate. Also, what we know, immunomodulation. As you know, the best answer to cancer, never get it. Beyond that, the best answer to cancer is probably the immune system. And the modification of the immune system is what we're after here. Understand, cancer is modifying the immune system, and therapies are also seeking to modify the immune system. So what we know, it inhibits PGE expression, inhibits FOXP3, inhibits Toll-like-4 receptor and 9 transcription. Toll-like-4 receptors, very important. They were involved in the SARS-CoV-2 pandemic because the virus was activating Toll-like-4 receptors. And these are very important in how bacteria, viruses can actually trigger the immune system. It's actually a preserved mechanism. And what's interesting in many cancers, the TL4 is upregulated. And when you look at people that are overweight, what's interesting about that is that a lot of this inflammation in the obese individual is actually coming from the gut. Most people think about dysbiosis, and that's correct, and they think about leaky gut, and that is correct as well. But what you have is you have this this toxin from a gram-negative bacteria from the gut that gets into the systemic circulation. It's called lipopolysaccharide, and that will in turn activate this LPS. Here it will inhibit TNF-alpha. It'll mediate IL-6 release. It will inhibit it. Let me back up. The LPS will stimulate the TL4. The artesunate will inhibit the LPS-mediated tumor necrosis factor and IL-6 release. If you remember back again also during the pandemic, IL-6 was a part of that quote-unquote cytokine storm. Back up a little bit more. In the podcast, I've talked about the unholy trinity. Check that out over the Practicing with Dr. Nathan Goodyear podcast. But there, I talk about how full-dose chemo, the literature is full of the examples of the what and the how that will actually stimulate the metastatic spread of cancer through IL-6 and also through TL4. But artesunate is interfering with this over-immune activation. It decreases IL-10, decreases tumor growth factor beta. Okay, this is where things get bizarre in the body. The whole body with cancer doesn't have cancer. Transforming growth factor beta, particularly 1, in healthy individuals and healthy cells actually is a tumor suppressor gene. It is a tumor suppressor. It will turn off abnormal growth. But in cancer, TGF-beta 1 particularly will actually accelerate the cancer growth. And here, artesunate decreases it. Novel concept. Just saw a patient today with, actually it was a virtual consult, significantly elevated TGF-1 beta. And so artesunate is something that were really important in this patient's therapy. Patient was only getting it once a week on a Monday, and so I told this patient that she needed to take it twice a week with the vitamin C. So Amber, if you're out there watching, good to see you. It was good to talk to you today. Increases natural killer cell cytotoxic activity. Who doesn't want natural killer cells activated and increased in number in the treatment of cancer? And that's exactly what artesunate does. Natural killer cells do exactly what their name implies. They naturally kill cancer cells. And then it inhibits nuclear factor kappa B activation, a key inflammatory transcription factor. It's also anti-infectious. So here is the question, or the answer to your question from earlier. Is artesunate antiviral? The short, yes, it is antiviral. It's also antibacterial. It's also antifungal. And it's also antiparasitic. And again, the World Health Organization has estimated that up to 20%, and I would say much, much more, of cancers are caused by infectious diseases, whether that be bacterial, fungal, viral, parasitic. Bacteria, H. pylori, Helicobacter pylori, gastric cancer. Fungal, a lot of those can be mycotoxins that are involved in the contribution to the genesis of cancer. Antiviral, there's at least 8 viruses that are cancer-causing viruses. HPV, hepatitis C, HIV, SARS-CoV-2 also matches that as well. Antiparasitic, liver flukes will actually contribute to cholangiocarcinoma. So here we're talking about not just artesunate as an antiparasitic, not just artesunate as an anti-infectious agent, but connecting it to the process of cancer, because up to 20%, and again, probably more, of all cancers are caused in part by infectious disease, bacteria, fungal, virus, and parasites. Got some more questions here. Let's see. That one's long. How do you pick the best treatment mix with artesunate for patient? Don't know if I exactly understand your question, but at the end, I actually have a slide where I talk about stacking, meaning how therapies are brought together, how artesunate is used with cancer. So the way I approach a patient that I'm thinking about artesunate is this a cancer type that has been shown that artesunate will be effective with? So for example, prostate cancer. All prostate cancers, artesunate on their surface is a therapy that I will employ. But let's say that CEA biomarker is elevated, pointing towards angiogenesis. And this is not colorectal cancer. Again, artesunate is something to consider. Say, for example, ferritin. This is a molecule that stores and transports iron. Say ferritin is elevated. Say iron is elevated. Say that Ki-67 is elevated. Artesunate can target that iron, can target that ferritin, lower that Ki-67, and lead to programmed cell death via ferroptosis. So it's not just a, protocol, but it's actually looking at the evidence through very specific, precise testing, and then using that to guide natural, holistic, and integrative treatments. That's precision therapy. That's the future of medicine. No longer do you have to go into your oncology office and sit there and get the exact same treatment as everybody else, unless you accept that. You are an individual. There's nobody like you. There's nobody like you with cancer. So guess what? There's nobody that is going to have the treatment strategy necessary to treat and heal from that cancer. Let's see. Is artesunate, is there a risk of cancer getting resistant to artesunate over time? Very good question, Riley. With every treatment, there is the risk of cancer becoming resistant, of pivoting, of mutating to the treatment. That's been shown with ketogenic metabolic therapy. That's been shown with vitamin C. Of course, it's been shown with chemotherapy and radiation. Understand, if VEGF is being expressed, vascular endothelial growth factor, and that is promoting angiogenesis, and the cancer is using that, and we're targeting that, the cancer is not just going to idly sit there and take that. The cancer, because of its high replication rate, it has a high tumor mutation burden, which you might see in the Ki-67. And with that mutability, you get all kinds of new mutations. So what may happen is you destroy those cancer cells with artesunate that are expressing the VEGF, but then what happens is, because the cancer is growing rapidly, the pressure you're putting on it causes those mutations to shift. Now the cancer continues to grow and it starts forming new mutations. Okay. This is how and what cancer does. This is why there needs to be constant ongoing evaluation. So the short of your answer is absolutely, but you don't wait for it to happen. You keep following, you keep looking. And here's another important strategy. You want to keep pivoting. Thomas Seyfried talked about the press pulse theory. And what this is in the treatment of cancer, understanding that what you need to do is provide constant pressure, push, stress the cancer cell continuously. And the ketogenic metabolic therapy is a good strategy there. But then come in and pulse, quick stressors. And here you can do artesunate, vitamin C 3 times 1 week. Then come, because of other markers, show DCA and vitamin C. So you can pivot and push. And what happens is this really doesn't allow cancer to just get into its zone, if you will, and allows you to really try to, at least some way, control against the mutability that is cancer. Epigenetics, of course, love epigenetics above genetics. What artesunate does here in cancer, it downregulates EGFR, upregulates P21, increases P53. That is a tumor suppressor gene expressed in over 60% of all cancers, and upregulates Beclin-1 transcription as well. Upregulates Beclin-1 transcription also. Okay, another question here. What is the most important treatment of breast cancer? What would make the best impact for holistic healing? Well, Gene, that is a great question. That is a loaded question as well. What is the most important treatment of breast cancer? I may surprise you with this answer, but then I'll provide some other examples. Belief, hope. When patients come to our clinic and I sit down and I talk to them, I can usually tell within 5 to 10 minutes if they're going to do well or not. It's their belief, their hope. Are they a fighter? Are they defeated? What kind of support do they have with their family, their friends, their loved ones? You know, what I tell my patients is that hope literally as a word means confidence in tomorrow, confidence in the future. There's no quantification or qualification of that future. That's our job. That's our job. So I would say healing begins with hope. Healing begins with belief. People would go, oh, I don't believe in that. Okay, well, let's look at a whole industry of science called sports medicine psychology. I love college football. Now it's college baseball season. So let's take to college baseball. No, let's do this a little bit. So if there are any Alabama fans up there, I know you beat us last year. I'm a Tennessee Volunteer fan. But 2 years ago, Tennessee beat Alabama. That kicker for Tennessee, last seconds of the game, went up there to kick the winning field goal. Do you think he believed he was going to make that field goal or miss it? There is a whole massive amount of science showing that the ability to see the outcome and the belief that that outcome is going to happen improves the odds of that outcome happening. Doesn't mean you have stage 4 cancer and you say, I'm just going to go drink water and I'm going to be cured. Okay. Obviously we have to put that in proper context, but with proper treatment, with proper planning, belief is where the possibility of healing begins. So I would say that. Also, I think it's important to understand everything you can about the tumor, about yourself individually, metabolically, what's the hormone status, the receptor status, of course, the estrogen receptors, progesterone receptors, the HER2, but also don't forget about the androgen receptors. What are the metabolic markers? What are the metabolomics of this cancer? Is it using glucose a lot? Is it using aspartate a lot? Is it using glutamine a lot? This is discernible information we can have right now. What is your gut microbiome like? We now know that much of what's happening with the immune system in the body, as well as relates to cancer treatment, can be affected, impacted through the gut, through actually delivering specific gut bacteria, not probably through probiotics, but probably best through a fecal transplant. We can actually induce immune activation and augment chemotherapy, radiation, immunotherapy, etc. So what I would say about the best treatments is, number one, bring hope and belief to the table. And then beyond that, find a natural, holistic, and integrative doctor that understands the arena of multiomics and be able to provide precision cancer care to you and for you, not one-size-fits-all approach. So I love biochemistry. So, forgive me for just showing some pathways here. This is, again, diving into the details, the rabbit hole, if you will, of the mechanisms of artesunate. I mentioned the STAT3. I mentioned the P13K, AKT, mTOR. Mentioned the nuclear factor kappa beta. Mentioned the beta-catenin. Mentioned the mitotic cell pathway, which you see down over there in the right lower column. Mentioned the capsaicin. All of these are mechanisms by which artesunate is understand now that it's not attacking one area. It's doing all of it. That's the beauty of holistic therapies. When you're introducing, say, a drug that blocks mTOR, there's drugs out there, everolimus, that will actually block mTOR directly. So let's say we're dealing with breast cancer that's expressing P13K, AKT, mTOR for your question. Everolimus can block mTOR directly. But if we give artesunate and this cancer actually happens to be expressing STAT3, capsaicin 3, stimulating the G1 to G2 phase. It's going to be M1 to G1 phase. Actually promoting nuclear factor kappa B. We could give artesunate and inhibit and affect all of those, versus the drug everolimus, which is an effective drug to inhibit mTOR. It's just going to hit the one. But if it's expressing all of those, artesunate will hit all of those. That is what I'm talking about when I talk about the trinity effect of natural therapies. They will heal and protect healthy cells, and they will damage and target unhealthy cells, here particularly cancer cells. So stacking, precision therapy stacking is kind of the verbiage I came up with to talk about how therapies are brought together. Cancer does not and cannot occur because of one thing, nor can cancer treatment result in healing by one thing. This goes back to Paul Ehrlich in the late 19th century, looking at the magic bullet theory, treating syphilis, neurosyphilis, with salvaricane. One disease, one chemical. That was actually the first chemotherapy. But you have to understand that cancer is a multitude of processes occurring together. I am more apt to believe that cancer is more of a metabolic disease that is stimulating the mutability, the mutations that we see that drive the cancer. That cancer as a cell is adapting to its inhospitable environment. It's shifting metabolically. That stimulates mutability. And what that does is that allows that cancer in the short term to survive. But then in the long term, becomes something we call cancer. In the short term, that's good. Long term, that's not good. So the stacking of therapies provide a proper perspective of, I think, that multi-omics approach. So vitamin C artesunate, I already talked about. This was an article that looked at triple IV therapy with artesunate, ascorbic acid, that's vitamin C, And they actually added in doxycycline, and this eradicated the circulating tumor cells and circulating tumor DNA. Wow. So that's a triad of therapies. Artesunate, ascorbic acid, and doxycycline actually eliminating circulating tumor cells. Stacking. Curcumin and artesunate. Now, both of these would be heavily metabolized by the liver, but here the study, quote, enhanced anti-cancer effects of artemisinin, again, another form, and curcumin-loaded nanoparticles against human colon cancer cells. Stacking. Two working synergistically together, not additive, but synergistically, being that they create effects that's bigger than just the two added together. Of course, most will look at cancer and look at it through the prism of the treatment of chemotherapy, radiation, surgery, and now the modern day immunotherapeutic. So let's pull one here. Cisplatin, very common chemotherapy. Cisplatin plus artesunate. Demonstrate that artesunate could enhance the anti-tumor of cisplatin. Now, this was in vitro and in vivo studies, okay? But this has actually been shown in human studies as well. So here we have artesunate augmenting chemotherapy. So if chemotherapy is the means to go to war on the body, and it does kill cancer cells, there's no question about it. It kills a lot of healthy cells as well. What if we could lower the dose of chemotherapy and do so by adding in something that broadens the anti-cancer effects? Oh, you can. Artesunate and cisplatin. What if cancer was expressing vascular endothelial growth factor, and this was promoting angiogenesis? Oh, by adding in artesunate and lowering the chemotherapy and giving it in a low-dose metronomic dosing strategy, both of those will target angiogenesis. So beyond just these, it's been shown to increase the sensitization of the cancer cells to radiation. So the way I look at it, everybody, and this is what the literature says too, everybody that's getting radiation should receive artesunate and vitamin C. These are pro-oxidative. Vitamin C is not antioxidative there. In the IV format, dosed appropriately, I talked about 777. There was a doc that was talking about you'd be able to dose therapeutically vitamin C orally, that you can dose it pro-oxidatively through the oral route. You cannot do that. That is not evidence-based. Check that out over the Practicing with Dr. Nathan Goodyear podcast. You must give it high dose via IV. But coupling it with artesunate, now you got something. Now you got something. Now that's going to couple with that radiation. You're going to add pro-oxidative with pro-oxidative with pro-oxidative. It's kind of the triple therapy there, and radiation just happens to be one of those. So what do we think we know? Well, that the only real side effect is anemia. When you look at malaria, malaria lives in red blood cells, in part with the life cycle of the parasite. So when you treat malaria with artesunate, guess what? Anemia can result. And the same applies in cancer. You can get anemia. So you just got to follow the hemoglobin hematocrit. And so it's very important to follow labs. Unfortunately, today we see a lot of cancer clinics that don't routinely follow them. What we think we know is that this anemia is reversible, meaning that sometimes when anemia does develop, that the anemia is not something that you can treat. Everybody focuses on how cancer likes hypoxic conditions. So if you're introducing a treatment that causes severe hypoxia, severe deficiencies in hemoglobin hematocrit, that's a problem. You got to balance everything there. What my experience has been is that the anemia associated with artesunate is definitely dose driven. And if you stay in the proper doses, couple it with the proper therapy, stack it, that is, you're going to really limit that effect. And that anemia is absolutely reversible. What also do we think we know? I would say it's not what we think we know. It's pretty sure. The IV route is superior to the oral route. Obviously, there's a limitation of the gastrointestinal tract with the oral route, but via the IV route, cancer is systemic from day one. And when cancer is systemic from day one, you have to understand that the only way to treat a systemic disease is to treat it systemically. And the IV route with artesunate is the only way to do that. So some more questions. Let's see, let me try to get back here. Okay, how can I order or get some artesunate or ivermectin? Being diagnosed with breast cancer with metastasis to brain, skull, and spine. I believe it may have reached the liver. Diagnosed in December. Treatment done. Radiation school. Now on capecitabine, Xeloda. Please, I have a daughter with special needs. First of all, Millie, my prayers go out to you. And let me tell you what, have hope, have faith. You can actually, there are some supplement forms of artemisinin, and you can see those if you just go to Amazon. You'll be able to find those. Again, there's limitation of the oral route there, but it's better than you not doing anything. I actually knew a urologist in Pakistan that would have all of his patients, that is men with prostate cancer, he would have them eat 2 salads a day with artemisinin leaves and have 3 cups of tea with artemisinin leaves. So it doesn't have to just be a supplement. You actually could add it into your diet. Could be a tea. So that's what I would say there. From the ivermectin, there's I'd find an integrative doctor that is focusing on ivermectin. Again, Paul Merrick, Pierre Corey, Kathleen Rudy, and myself are doing that multi-observational study on ivermectin in cancer. So check out the FLCCC website, and there you can actually find some doctors there that you can reach out to for referrals to actually get on some ivermectin as a part of a clinical study. Very safe therapy, by the way. Oh, this is really good. What future research directions do you see as critical for integrating artesunate into standard oncology practice? Beyond the multiomics, I think the precision nature of research is what are the combination of therapies that work best? What's the sequencing of therapies that work best? Is it a therapy strategy with artesunate that works best with IV route? Is it a therapy that works best intratumorally, injected directly into the tumor? What's the best therapy? And I would say that's where I would approach on the future of the science around artesunate. What's its best stacking? What's its best sequencing? And then what's the best delivery? And so that's what I would focus on there. What we think we know also, a lot of studies suggest it improves quality of life. More and more I'm seeing patients that come in that want quality of life and quantity as well. And that makes sense. We as physicians, we in the medical arena should focus on quantity and quality. And patients deserve that, and patients are demanding it. And research suggests artesunate improves quality of life. It improves survival rates, and it reduces recurrent disease. So limited studies here, but here nonetheless present. So what we don't know, will artesunate work with or without iron? I tend to believe that the more iron that can be present in the cancer, the more effective that artesunate will be. But high iron in the cancer environment, the tumor microenvironment, is pro-proliferative. So if somebody doesn't recognize that and then use artesunate to target, that cancer is just churning and burning with the iron. Is it apoptosis versus ferroptosis versus autophagy, or is it all of it in terms of the programmed cell death? What's the optimal dosage? What's the frequency, right? This is based on the half-life. Is it best as a monotherapy or stacking? It's probably the stacking for sure. I think I answered that one. Combination and sequence. Again, we don't really know. And that ties into the question about research. Is it useful in all cancer types? Probably not. There's no one cancer type that one treatment is going to treat all. Again, it's what's the cancer expressing? What's the mutability? What's the mutations the cancer is expressing, and how do we target that? The anemia that's present, is it reversible, and is it renal toxic? At least from my perspective, my experience, and I've been using this since 2018, it's a very safe therapy. The major side effect is anemia, but it's something that can be managed effectively and safely with minimal problems. So great therapy, great treatment, very safe. There's definitely some things that we need to learn more about with it, but it's one that is highly effective. So let's get to some more questions here. Let's see. Wenda, You list melanoma as a cancer artesunate is very effective against. What about a very aggressive squamous cell cancer where tiny tumors are popping up weekly on a person's leg? Doctor recommending surgery with skin grafts and chemotherapy. I was talking to a integrative dermatologist about a month ago, and he said that skin cancer has changed since the pandemic. Skin cancer is not the same. Squamous cell cancers, basal cell carcinomas, which tend to be very superficial for the most part, and that they're actually invading and spreading. So that's just a little aside. Any cancer that is expressing those areas that I mentioned, angiogenesis, proliferation, mitosis, and those areas that you can specifically monitor and show, artesunate will work there. Nuclear factor kappa B, capsase 3-9, nuclear P13K, AKT, mTOR, BAX, BCL2 alterations, hedgehog, any of those artesunate can target. And I know hedgehog, you may go, oh, come on. No, it's real. Look it up. Hedgehog. I don't know who came up with it. I don't know if it was one guy named Hedge, one Dr. Hedge, and one Dr. Hogg. I'd like to know how they came up with that one. So let me get back to that question. So what I would say is with the squamous cell carcinoma there that you're describing, it's behaving very differently, very, very aberrant. And so in that, I think there needs to be, genomic testing. There needs to be testing of that tumor to be able to determine what's the most effective therapy for that. I wouldn't just blindly treat it, but I would want to know what is that tumor expressing, thus how can I target it? What's the best dose of artesunate for cancer treatment, and does it change with the type of cancer? Casey, thanks for the question, Casey. Yeah, it does. When you look at vitamin C, here's where I'll draw from that on. There's a lot of things that affect vitamin C in terms of cancer treatment. If a 5'2", 125-pound patient sitting next to a 6'6", 366-pound patient, they intuitively know, wait a second, why are they getting 50 grams vitamin C and I'm getting 50 grams vitamin C? The weight alone, the body surface alone dictates different dose. Vitamin C should be dosed based on weight. In fact, high dose, the bare minimum is 1.5 grams per kilogram per day that you treat. But what about inflammation? What about tumor burden? How much cancer is there? How much is spread? What's the level of deficiency? Now, of course, artesunate's not a natural substance in our body, but those apply as well. Those variables apply as well. What's the tumor? What's the weight of the individual? What's the tumor size? How much tumor is present? Artesunate is also dosed by weight, milligrams per kilogram. And I think a good place to start is 1.5 milligrams per kilogram, but it needs to be under the guidance of a physician that understands how to deliver and how to combine and sequence these therapies. And again, how to monitor for side effects, because typically the treatment requires a change and an increase in dose, an assessment and a change in dose to increase effectiveness. Good question, though. Carol, I am at a crossroads with my treatment. Do you do consults for people who are not currently a patient at Brio or do not have the funds to attend the program at this time? Currently, Carol, at this time, what I would recommend there is you just, if you haven't reached out to the patient care coordinators at Brio-Medical, which you can find over at the Brio-Medical.com website, there's a form you can fill out there and they'll be happy to talk to you. And you may not realize that you actually can afford treatment. But right now, the team at Brio does not do consults there. But reach out and they can help you there. Valerie, okay. I was diagnosed with stage 4 breast cancer with metastasis to bones, now at 15 years. I have liver mets. Can I stack ivermectin and artesunate? I think I would answer that question by asking you this question. First, yes, you can. Absolutely. The question is, should you? How is this cancer behaving? Your appropriate question should be, so Dr. Goodyear, are you asking for a biopsy? Well, I think we're fast approaching a time where we don't need that anymore, Valerie. that we may be able to actually, through the blood, look at circulating fragmented genetic material, and that can alone determine some of the mutations of the cancer, and we can target that way. Can you stack ivermectin and artesunate? Yes. Should you? That's the question. That's the appropriate question. Carol asks, what do you think about the Bojanski botanicals? I think they're good. Had a pleasure to meet the daughter of the PhD that came up with that. He's out of France. I'm going blank on her name, so my apologies. Down in Bayo de Bravo last year, I think it was. They have some really good products. One of the products for prostate, very, very good. I take it myself. So yeah, I do like them. There you go. Let's see what else. Okay. Bunch of good questions. Let's see. Here's a long one. My mother has metastatic colon cancer that has spread to liver and pelvis. She also has Alzheimer's. Would you be able to treat both diseases? She's currently on 5-FU and an antibody, and a monoclonal antibody. Not sure of exact spelling. Yeah, whoever comes up with the names of those new therapies, monoclonal antibodies, inhibitory therapies, they should be tarred and feathered. I mean, at least with hedgehog, it's like, okay, I can remember that, but they come up with these names that you just can't even pronounce or spell. It's extremely harsh, and she has had 8 treatments since, I can imagine, since November 2023, wanting to stop chemo and do integrative if it can help her. It absolutely can help her. It absolutely can help her. She dropped her email in here, so Aaron, make sure that gets sent to the team so that they can reach out to her. So we'll have somebody from the team reach out to you, and they can contact you with regards to definitely how the team at Brio can help you. What are my thoughts? There's absolutely the ability to treat both. One of the things I would say about full dose chemo is it's very hard on the brain. Very hard on the brain. And so when you look at somebody with Alzheimer's, the full dose chemo is going to aggravate that process. There's many things that you can do to really help the brain. Boswellia IV, curcumin IV, RG3 nasal spray, CBD IV. These are all things that can be employed and used that cross the blood-brain barrier and can be utilized to actually help the brain. Artesunate does readily cross the blood-brain barrier as well. I'm not aware of any artesunate studies with Alzheimer's, but if there's cancer that is spread to the brain, then it could be effective there. But I would focus on trying to reduce the inflammation within the brain with the Boswellia, with the curcumin, and with the RG3 and CBD IV. Do I take a artesunate tea? I don't. I just had the colleague who in Pakistan, he told me that he didn't have the ability to get all the expensive drugs that we use that can be used by conventional oncology here in the U.S. And so it was very interesting to me about he was offering up that he focuses on diet and teas because that's something all of his patients could afford and it was readily accessible. How about treating prostate cancer? I guess here you're talking about artesunate. Absolutely. When you look at prostate cancer, artesunate's it's, in my opinion, my experience, it's an absolute must. I've seen artesunate and vitamin C high dose be very, very effective in the treatment of prostate cancer on a wide multitude of stages of cancer. A&G, I'm not sure who that does your clinic, see children 13 years old for glioblastomas. We don't see children. So I'm trying to think if I know of any clinics that would see. I will think about that and try to come up with maybe some potential names some clinics or some docs where they actually do treat kids. And if you would please drop in there some type of contact information so the team could send that information to you, that would be, I think that would be great. But I will try to come up with some names tonight. I do have a name, but I want to make sure that that they do before I get your hopes up. Okay. So just drop that in there. Okay. My niece, 22 years old this year, was diagnosed with stage 4 neuroblastoma, October 2022. She's almost finished with conventional treatment, 2 surgeries, chemo, and radiation. I bet she's happy. And you are too, I'm sure. She has almost no evidence of disease. Fantastic. What are things for her to do to detox all of that out of her system and prevent recurrence? Thanks so much. It's going to sound oversimplified, but it's actually true because of her type of cancer. Diet, lifestyle. You know, we talk about, here we're talking about Artesunate. We talk about fancy treatments. We talk about holistic, integrative, innovative treatments. I love to innovate. That is what's very important. Understand, cancer is constantly evolving. Sitting back and idly just saying, I'm going to sit right here and just do these treatments for the treatment of cancer because I'm comfortable with this model, it doesn't work. Cancer is changing. It's constantly mutating. It is our physicians. It is our responsibility as physicians, or a business's responsibility that treats patients with cancer, to constantly seek innovation. If they don't, they're not serving their purpose. So, nutrition, it gets overlooked. Ketogenic metabolic therapy here can be one that drives further treatment, and it's one that can also drive healing. Detoxification is a normal process that every cell must undergo. Of course, we focus on the detoxification of the big organs like the skin, the liver, the kidneys, the lymphatics, etc. But ketogenic metabolic therapy can drive that cleaning, detoxification process. Exercise. A little sweat doesn't hurt anybody. Exercise gets the lymphatics flowing. Exercise gets urine building so that you then excrete it. Exercise drives detoxification. These are simple things. You don't have to get fancy. Now, you can do things like adding in alpha lipoic acid to help the liver, adding in milk thistle to help the liver. There's things that you could do. NAC, which I wouldn't advise that in cancer, but you can use that to help the kidneys. There's things that you can supplement-wise and take, but I would say, you know, if you do some very simple things, eat right, exercise, and that doesn't mean you have to do a triathlon, and then get sleep. That's going to help your body detox. So sometimes the simplest is the best. Wow, great questions. I appreciate everybody's. And Angie, thanks for that email. I've got it. I'm going to come up with hopefully a couple options, and we'll work towards getting that sent to you tomorrow. So please be patient. I'll make sure I get that to you. Okay. So God bless you guys. Have a wonderful evening, a great rest of your weekend. Thank you for these great questions. Artesunate. It's not just for malaria. It's for the treatment of cancer. And it's a safe one as well. Thanks again, guys. Talk to you later.